Welcome to Midlactome. Today we are going to discuss clinical case 2. So let's start. First of all, if there is a patient who comes to you and that patient is actually a boy and that boy is actually the 5-year-old. When I take the history, then first thing which I notice is the diabetic. The patient has diabetic ketoacidosis. So that is the first thing. That patient, 5-year-old boy, having diabetic ketoacidosis. Next thing which I noticed is the ptosis of the eye. Ptosis of eyelid means drooping of the eyelids. This is the second symptoms or the physical examinations. Okay. And the third thing which I noticed is the periorbital swelling. Swelling that is around the eye. So this is actually the third thing. This is actually periorbital swelling. So this is the third thing. And I also found that the skin lesion, necrotic skin lesion, means you see the lot of necrosis under the eye. So this is the fourth thing which I noticed. That is the necrotic skin lesion below the eye. So this is actually the condition below eye, or if I say under eye. Okay. So these are basically the clinical examination or physical examination. So after the physical examination, I say that the patient has to go to the test, biopsy. So actually the patient, after the biopsy, so that patient in the biopsy you will see the non-septate hyphae. This is the first condition which found in the biopsy, and biopsy of the necrotic skin lesions. Okay, now the second thing is and that septate hyphae is actually 90 degree, and they are actually present at 90 degree. Non-septate hyphae, actually we know that the fungus is actually lie in the hyphae form, and that hyphae is actually form the 90 degree at different location. So this is actually the two condition. Non-septate hyphae means there is no septum, means separation between the hyphae. This is actually the single cell, and you can consider it as a whole cell. Okay. Second thing is the angle is 90 degree. Okay. More or less can happy. So this is the biopsy test. Okay. Now after that, what disease actually the patient has? So patient has two things. This one and from this thing, diabetic ketoacidosis. Then I say that the patient has mucormycosis. So this is the condition. Why? Diabetic ketoacidosis is strengthened the condition because mucormycosis is actually a disease that is caused by the fungus like mucor, and other species can rhizopus can also, and abscedia, etc. That cause the mucormycosis. Okay. And that disease is actually happens due to the other disease. The chances of the mucormycosis increases when there is a deficiency in the when there is an immune deficiency in the body. So this happens in different situations. When you will see diabetic ketoacidosis, bone marrow transplant, and you can also see like if there is a patient leukemia and burns patient. So these are basically the four conditions that can cause the mucormycosis, because that they provide the suitable conditions for the attack of the fungus. Okay. Now if we see how fungus enters in our body and affect the body. Okay. So if you see that here is the spores of the fungus that are actually present in the environment, that can enter in our body through different pathway. It can enter through the mouth, and it can also enter through the nose. Okay. Now if you see that from the mouth, it can either enter into the lungs, trachea. Through the trachea it can enter to the lungs that are actually present at the ventral side, and it can also enter through the esophagus that are actually present at the dorsal side of the trachea, and can enter into the GIT tract. So it's mean, if you notice, that three most important places that can affected by the fungus. So first thing, as we know that there are different sinuses that are actually present in the face. So first thing is the paranasal sinus. Okay, this thing, fungus can attack the paranasal sinus that are actually present in the face. Okay. Second thing, it can affect the lungs because spores can enter in the lungs as well. And the third thing, if you notice, GIT tract. Actually, these spores affect or proliferate in the blood vessel wall and block that wall, and due to the blockage of the blood vessel, you see the necrosis. That's why you see that the necrotic skin lesion, you see necrotic skin lesion on below the eye. Why? Because these spores affect the sinuses. So when these spores affect the sinuses, then you will see the necrosis on the face. So this is the condition. Okay, that's point also strengthen our case that the mucormycosis is the most likely disease that is actually present in the patient. Okay, so this is all about the clinical examination and what medicines actually works. So first thing, that it is actually a fungal disease, and the important, if I say that the Amphoterin B, you can use this as a treatment, and you can also go to the surgery. From the surgical process, you can remove the necrotic tissue. Okay. Second thing, if there is a patient and that patient says that he has a history of kidney damage, then I would not prescribe Amphoterin B. I prescribe Liposomal Amphoterin B. This is the alternative case in case of kidney damage. And the third medicine you can also use is the Posaconazole. Posaconazole. This can also use as a prophylactic treatment also in the fungal disease. So this is all about the clinical case 2. If you have any question, you may ask in the comment section. Thank you.